You know what I've not got this time? I haven't got my bottle of water to take my naxes. I've not been drinking much water tonight, so I need to top up on that. I tell you what are good, these smartwatches, if you have got lung disease, because some of them come with this is just the, I don't even know what model it is, I think it's the Huawei one. They come with heart rate and lung oxygen sats, and sometimes they tell you to get up and move a bit, which is also good for lung disease. If we sit on the sofa too much and we don't move, these lungs, same with my mother, same with someone else I know, if we sit on the couch too much with a lung disease, we'll deteriorate faster than we should really. So these smartwatches, I was a bit reluctant to it, you know, having something that's got some kind of, it's obviously a Bluetooth device there that flashes a lot, it's reading the wrist, and some of these also tell you if you've been disturbed in your sleep or not. So they're a really good thing to have, especially if you're thinking you may have sleep apnea, or you're feeling tired all the time and you can't work it out why, you don't know if you've got a disturbance sleep. These are pretty good. I did give it someone, we had a little bit of a fallout, so I said give it me back, but I've not reset it yet. So yeah, they're pretty good anyway, guys. Pretty good. And this one's quite colourful. It lights up really nice, the dials on the watch. So really good. I don't know if it's as accurate as an oxygen sat, but it can give you some pointers if you're not feeling too good. My mother has had their oxygen sats on just shortly, and they were creeping down to about 95, 94. So I told my mother to give it a good cough, and it slowly went up to 96. Her heart rate was quite normal, about 85. Now, my mother with her bronchitis slowed down a hell of a lot. Now, one reason is because she just allowed herself to deteriorate like most people do. Yeah, they just say, this is me and this is me. So my mother's got the same approach, and she'll sit down on the sofa or the couch, and my sister will do a lot for her. And it got to the point where I said, it's nice that my sister's doing all this, but it's taking away something my mother should do. She shouldn't sit down in a chair all day, especially when she's capable of doing something when she can. So we've got my mum doing slightly a little bit more, nothing major. But today she just seems a little bit off. She's not talking much. She's not coughing that bad. I just said I'm going to keep an eye on them sats. So that's what we'll do. You know, knowledge is key. So everyone with lung disease in 2024 should own a probe for the oxygen, if not a smartwatch. And they're pretty cheap. This Huawei smartwatch was only £40, which gives you a good detail, everything. It gives you analysis with your sleep, analysis with your oxygen sats, and analysis with your heart. So it's good. Also, blood pressure monitor is pretty good, because most people don't know that when we have chest infections, there's key signs these doctors look for when they're going to admit us in hospital, and these are the three normally. It'll be temperature, so anything over 37, low grade temperature. Anything higher is a high grade. Anything over 39 is high grade temperature. Okay. They'll look for drops in your saturation, such as your oxygen level will be a big indication something's not right. They'll look at the increased heart rate. So if your oxygen's coming down and your heart rate is increasing, it means your body is fighting something. So these are all indicators. And the next thing is your blood pressure. When the doctor checks your blood pressure, if it's high, that's indication of, fighting infection. And 9 times out of 10, if you're showing at least 2 of these, you will get admitted. Normally they'll send you home if you look well and fit. They might send you home with a packet of some antibiotics, some steroids, and send you home. It's only when there's more flagging up, like the heart rate's quite high, your tachycardia, your lung saturations are very, very low, your temperature's very high, they need to get intravenous antibiotics in your system. So not everyone who presents themselves to A&E will get admitted. It's normally the people like me who have bronchiectasis, a long history of pneumonias, a long history of clinical antibiotics throughout their life, and a long history of chest infections with different bugs. So me, someone like cystic fibrosis, someone who's had, pneumonia somewhere in their life, they're more likely to get admitted because they're high risk, you see. So yeah, most people who get a chest infection, if they're fitting well, amoxicillin, and they'll feel better within 3 days. Someone like us, who've gone through countless packs of antibiotics and tried every oral antibiotic on the planet, becoming resistant to them antibiotics. So even if in the laboratory it says, this infection, what they picked up, this bacteria, this antibiotic will work, it's not always the case, because even though it's not showing a resistance to the antibiotic, we know when we're taking it, we're not feeling any better. So we'll go to about 3 days, 5 days, then they may switch that antibiotic, and with another oral antibiotic, the same thing might happen. So that's why we then present to accident emergency, or we get a message to our specialist, and then our specialist will look into all kinds of things such as our last sputum culture, and he'll work out what he thinks we're growing, and then he'll make either an admission, or in my case and many other cases, you will start your clinical home intravenous antibiotics. Hi there, I don't know, you okay mate? Wasn't being rude, but I just can't go along with the chat, especially when I'm thinking about what to speak about. And the person putting ups and downs, it shows how mature you are. It doesn't actually show a down. Why don't you take your ass out of the channel and piss off? But yeah, I'm just talking about antibiotics really. We've got some here, a bit of doxycycline. Show you a doxycycline now. So you get these, yeah? These are my standard rescue pack. So I'll take 2 of them to start off with, and you always take your doxycycline with a meal. And the key to not upsetting your stomach with doxycycline is drinking a pint of milk, or taking your omeprazole. If you sort of stagger that omeprazole because you don't want to take it all the time, the perfect time would be to take it when you're on antibiotics, because we all know antibiotics affect your digestive tract. They kill all the good bacteria, and they also cause acid reflux. So I'll just show you a little doxycycline, what it's like. So that's a little doxycycline tablet there. And I think they've done something to better this tablet, or because I've been on so many tablets, my resistance to certain tablets have got a little bit better. Because doxycycline used to throw me off a bit. Clarithromycin, I've not touched that for a very long time, because one, it's a disgusting tablet to take. It's about that large, and you can taste the imagine you taste a tablet. So you put a tablet in your mouth and you try to drink it, but you can't swallow it, and that tablet dissolves in your mouth and it gives you a disgusting taste. Well, clarithromycin is that 10 times that, and it's even if you just take it naturally and it goes down the first time, so you just get this repeated nasty side effect. And normally you have to be on a 14-day course of clarithromycin in our cases, which are very, very hard. So I basically I've got a resistance to it, or an allergy, which I'll only take it if it's life and death, and clarithromycin is the only antibiotic out there. Other than that, no. Azithromycin, again, side effects. Colamycin, don't know if you know about colamycin. Well, I used to take colamycin inhaled, and I started getting a sore throat, so I had to come off that. I used to be on nebulized amoxicillin, and that worked okay for 6 months. After 6 months to 12 months, that stops working. So it's always a game. It's always like a game in this field, which is always alternative. Is that no alternate the antibiotics, so we don't get resistant, and so they actually kill the bugs as well. So that's what I'm going to leave you on. Just a random live, guys. I'm popping up left, right, and centre. Take it easy.